So let's deal with one of the highest yield FMProC scenarios you can possibly master for your residency match. This is the kind of question that quietly separates average scores from strong scores. You are under time pressure, the team doesn't agree, and you have to decide whether to handle it yourself or to escalate. Let's walk through it properly. So this is the scenario I'll give you. You're a family medicine resident covering a busy clinic near the end of the day. Your next patient has already been waiting longer than expected. During the visit, the patient starts describing new symptoms that weren't part of the original reason for the appointment. They are worried, emotional, and asking for reassurance. You glance at the clock and another patient is also waiting in the waiting room. And your other colleague is signaling that, hey, doc, you are running late. And your supervising physician is nearby, but he's also very busy. You feel the pressure. Now, pause. This is exactly what the FMProC is testing you on. Before looking at the answer options, strong candidates will stop and do something very, very specific. What would they do? They will name the problem. Let me say it again. Strong candidates will name the problem. You know, the real problem here is not time. It's not even efficiency. The real problem here is what we call prioritization under pressure while protecting patient safety and team function. So in this particular scenario, two things are coming into play: patient safety and team function. Patient safety, as in the patient is bringing up all these concerns they have, right? And team function is time management, right? Because if you don't finish early, maybe the clinic will delay. The ladies at the front desk or the people at the front desk who are managing the clinic will have to stay longer. You know, you may not be able to discuss cases with your preceptor quickly. The preceptor may have to also attend to family issues. So we are dealing with patient safety and prioritization and how you're going to merge these two so that the team will function well. So now let's go to step 2. What values are being tested in this question? The values which are being tested are: number 1, adaptability; number 2, team collaboration; number 3, professional integrity; and still patient-centered care. Are you putting the patient at the center of all the decisions you're making? Now, one thing you have to understand is that the FMProC almost never just look at one thing. You know, they stack the concepts together on top of one another. So let's imagine the options. So if you have options like, I'll reassure the patient quickly, address what I can, and move on so I don't delay the rest of the clinic, you realize that this option is very tempting. Very, very tempting. It sounds like an efficient, time-effective option. It sounds very responsible, and a lot of candidates will pick it. But slow down. What is the risk with choosing an option like this? What's the actual risk? The issue is that you might miss something important in the patient. In this case, it looks like you are prioritizing time over safety, and you are making that decision alone under a lot of pressure. And this usually will score middle or low. And it's because it's not a terrible answer, but it has some risk associated with it. And FMProC does not love answers which you go like, I'll just handle it myself, when there's obviously some uncertainty which exists in the whole case, right? So let's look at option 2. Option 2 will say, I tell the patient that their concerns are not appropriate for today's visit and that they should book another appointment. You realize that this particular option will drop down in the pecking order of FMProC quickly. Why? Because it is very dismissive. You are dismissing the patient's concern. And this option is protecting the schedule, not the patient. And it lacks a lot of empathy. And so this is a very low scoring response. And it has to go down, right? Now let's look at option 3. Option 3 will say something like this: I will pause, acknowledge the patient's concerns, and explain the time constraints honestly, and ask if they are comfortable involving my supervising physician to decide the next best step. Look at what this particular option does. It is an option where the candidate is not panicking. The candidate does not come across as avoiding, the situation, and it does not overpromise anything. This option also acknowledges the patient and it respects the time pressure. And it also escalates the problem appropriately, not dramatically, not too quickly. And the truth is that this is the classic high-scoring FMProC thinking you have to adopt. What about option 4? Option 4 might say something like this. I will immediately interrupt the supervising physician and insist that they see the patient right away. This is very tricky. Escalation in this situation is not wrong, but how you escalate is what matters. So if there is no clear emergency yet, this can look very reactive and disruptive to the flow, because maybe your supervisor may be talking to one of your other colleagues about a patient they have also seen, and going in to just interrupt them is not the very good idea. So it often scores below option 3, even though escalation is involved. So what am I trying to say here? When it comes to escalation, FMProC prefers measured escalation, not panic escalation. So now, if this is a ranking question, your job is to compare which option best balances patient safety, team collaboration, professional judgment, and time pressure. And usually, it is the option that communicates transparently, involves the supervisor in a very collaborative manner, and avoids unilateral decision making. That is the option which will move to the top. Now, let's flip it into a rating question. Assuming this question was asking you to rate, because this is where people get confused. You are not asking which one is perfect. You are rather asking how good or bad is each option on its own. And anything that dismisses the patient's concern will drop down. Okay? Anything that avoids responsibility will also drop down. Anything that handles uncertainty alone must also drop down. And anything that shares responsibility appropriately will have to be taken up. So here is a big insight. FMProC is not testing whether you can cope under pressure. It's rather testing whether you know when not to cope under pressure alone. You see the difference here? And handling everything yourself under time pressure feels like you're a strong doctor, but in family medicine training, knowing when to pause and escalate your issues is a big strength, not taking everything upon yourself all the time. So let me give you the internal question that a high-scoring candidate will silently ask in a question like this. Is this a situation where acting alone could create a risk? If the answer is yes, even slightly yes, then escalation becomes a safer move. But the escalation must not also be done in panic. It must be a form of escalation which is being done collaboratively. And this is why this scenario is a score breaker. Many candidates think, I don't want to look incompetent. But FMProC is thinking in a different way. We don't want you to be an unsafe, independent resident. And that is where the difference is. So you have to just ask yourself, on a pecking order, which one do you prefer? To look at like somebody who collaborates with other team members, or to be somebody who just breezes through even a difficult situation, but at the same time, you have a track record of being an unsafe, independent person. So how you prepare for scenarios like this is very critical. You have to practice spotting uncertainty and pressure together. And whenever these two appear in a question, you should really slow down. Just slow down. Because FMProC will almost always reward transparency, shared decision making, and proportionate escalation. It will not really put being heroic and doing things on your own at a higher pedestal than transparency, shared decision making, and appropriate proportional escalation. So if you remember one line from this entire question walkthrough, remember this, that FMProC does not reward doing more. It rather will reward doing the right thing at the right level.